Of this next story, but we want to tell it because it's a classic example of an important trade-off in medical care. There is a never-ending battle between the need to slow the pace of increasing costs against the enormous benefits that come from medical advances. KXAN's Jim Swift reports that for the patients who do benefit, those medical advances are nothing to thumb a nose at.
Tom Bury has always worked with his hands for fun and for a living.
I got into a battle with a forklift, and the forklift won, actually.
Early last year, Bury got his thumb tangled up in some filament banding strap on a moving forklift at his job.
Don't know how it happened exactly, but it had like a garrote of some type around the thumb and snapped it right off.
Not only did the left thumb get snapped right off, it got mangled in the process, rendering it useless for replacement surgery. And yet, a look at Bury's left hand today reveals the thumb is still there. Or is it?
The next day I had an appointment with Dr. Stephen Henry, and he looked at it and said, yeah, we can put your toe on there real quick, no problem.
A lot of people, when you present this option to them, they're afraid to use their toe for fear of functional compromise at the foot.
That was his idea. He's the one that said it. I wasn't even thinking about toes at that point.
I assured Tom that that is not the case, that unless he were an Olympic long jumper that he wouldn't even notice it.
I don't play soccer, you know, so I don't have to worry about kicking things.
He was very willing to use the toe to reconstruct his thumb.
So, on March 4th, 2010, some 3 weeks after the mishap, Dr. Stephen Henry went to work on Tom Bury in a Brackenridge Hospital operating room. The procedure called for the surgeon to carefully remove the patient's left big toe and painstakingly attach it to what remained of the thumb.
You have to restore bone and cartilage and joint and the ligaments that hold the joints together, the tendons that move the joints, the sheath that the tendon runs through, and then the stuff on the surface, the skin and the nail, and of course the nerves and the arteries and the veins.
I'm just happy as an owl up in the tree looking at a rat, I guess. You know, it's just really a great thing to have done.
Bury doesn't miss his toe at all, he says. And with the restored left hand, he can now do things that would have been difficult, if not impossible, without the surgery. Things as simple as tying his shoes. He does, however, admit to some confusing situations resulting from the procedure.
I was going into the grocery store one day and I saw the sign, and they're there everywhere. No shirt, no shoes, no service. Well, I didn't know if I should go in or not. I got a toe on my hand.
So he got a shoe. Jim Swift, KXAN News.
As remarkable all that is, scientists are hard at work on ways to give people like Tom Bury body parts from cadavers without having to make the patients use anti-rejection drugs for the rest of their lives. From his post at the Seton Institute of Reconstructive Plastic Surgery, Dr. Henry predicts such procedures will be possible within as little as 10 years.